This video is proudly sponsored by Petcube. More on this later in the video. Hey friends, welcome to the video and welcome back to the channel. My name is Steven and I am now a third year dental student. Welcome to the third year and specifically welcome to the clinic. This is going to be my first clinic vlog. If you're unaware, the first 2 years of dental school are basically lecture and lab. You do a lot of work in preclinical labs where you're learning the skills that you will eventually use in the clinic, and the clinic comes up for you in the third year. So I am now treating live patients in the clinic, and today I'm going to be taking you along with me for the first time into the clinic for an actual appointment. Now it's important to note that I'm not sure how much footage I'm going to be able to get. It's very important that HIPAA is followed and patient privacy is paramount. So I'm not sure how much footage I'm going to be able to actually get of this experience, but I do have a perio appointment this afternoon with one of my patients, and I plan to bring you into the clinic and show you as much as I can about the process. If you're interested in anything that I've done before this point in dental school, you can check out the playlist that I have right here. That is my Life in Dental School playlist. It will show you essentially 2 years of the preclinical lab courses that we took. Now it's into the real stuff. So let's get to campus and get into clinic and see what we can get.
What up, boss?
I was hiding in the bushes.
I see that.
I get a shot of you coming out of the bushes.
Ooh, I don't know about that.
This is my clinic partner.
What up?
This is Smith. You've seen him in a couple of the videos. What are you doing today?
Checking out my patient right now.
Are they coming?
They are.
What are you doing?
He asked how long it was going to take. I said probably about 90 minutes.
90 minutes for what?
Treatment plan, but he might need a consultation.
Nice.
With AEGD.
So the first step of this process is to set up a cubicle, and I've got a lot of stuff to get, a lot of stuff to grab, including my instruments, which are in sterilization. So I'll take you up there once I get there, and I'll do a little time lapse here of setting up the cubicle as well. Our sterilization area, and basically all of our sterilized instruments are going to go in these lockers. Before our appointments, we can come over, grab whatever we need, and use them in our appointments. So before I get into anything, massive shout out to the wonderful ladies who help us with our sterilization. Couldn't do it without them. And now this is my other locker, which holds everything that's not sterilized, and that's going to include the impressions box and the start check box, along with my loops for eye protection. This is everything I just grabbed from sterilization that I'll need for the appointment. Everything else right in here.
Hi.
Hi, Thao. How's clinic going?
It's awesome.
Is it?
Well, yeah. I think it's way better than like sitting in a lecture and studying. And,
Yeah.
like now you kind of have a different stress, but it's like
It's the real thing.
adapting what you
Yeah.
learn. So
Yeah.
it's been fun.
You were in the Stab Lab vlog. All the OGs remember that.
We've come so far.
We've come so far.
Have you done your first injection?
Yeah, yeah. I haven't hit an IA though since then, so I'm screwed if I have to do a lower.
I've literally looked
bunch of infiltrations.
Yeah, I was gonna say I'm gonna look at all my operative and see which ones needs like 6, 7, 8, 9.
Yeah.
All
Just
anterior, maxillary anteriors is what I'm looking for.
All right, thank you for being in the vlog.
Bye.
Yeah. So my patient is here,
Oh, he said 1:30 after.
and it's time to get to work. Catch up with you after the appointment. Just like that, the appointment is finished. I've got some impressions right here that I need to go pour up. So I'm gonna go get those poured up because it has to be done very quickly after being taken. And I'll show you a little bit of that process. Stuff that's sterilized goes back to sterilization, goes back in our sterilized locker. So we keep everything that's not sterilized here and everything that's sterilized upstairs. Honestly, my biggest concern with clinic so far hasn't been the clinical dentistry, hasn't been learning the software or the patient interaction. My biggest concern with clinic so far has been the fact that I have to leave my little puppy at home in her crate. For weeks I've done this and I've worried about her and wished that there was a way I could just see her in her crate and just know that she was okay. Fortunately, Petcube has made that possible for me. Petcube makes the best home cameras for pet parents like me, and I have had the distinct pleasure of using the Petcube Bites 2 Lite for the past couple of weeks. The Bites 2 Lite has a full HD 1080p camera that live streams Daisy's activity in her crate directly to my iPhone. It also has two-way audio, so I can hear her in her crate, and if I want to, she can hear me. My favorite part though, and this is actually amazing, it has a treat dispenser, which allows me to literally flick treats from my phone with the Petcube app to Daisy in her crate. All I have to do is log into the Petcube app, I admire Daisy's cuteness for a few seconds, and then I shower her with delicious signs of my affection. Petcube can alert you of any potentially dangerous activity that's occurring in your home while you're away. Just chugging some water while I'm doing my ad read. You can also save special photo and video moments of your pet being its cute self. Petcube sells a variety of cameras that allow you to monitor your pet while you're away, and if you're looking to buy one, take a couple of extra dollars off by using my code StephenPRay5 for 5% off site-wide. Don't ever worry about your pet being home alone again. Just beware of a new distraction on your phone during your dental school lectures. Thank you so very much to Petcube for sponsoring this video. Now back to the vlog. And with that, let me get home, see Daisy, let her out, and then I will tell you everything about how the appointment went, the entire process. We'll get into all the details, and then a little bit of a discussion on clinic as a whole. Look at her in her crate. Such a sad girl. Aw. I'm coming, girly.
I watched you on the TV. I used the Petcube to watch you. Hi.
My apartment is an absolute wreck, so if you've seen it at any point in this video and thought, no judgments. So that was essentially my first experience filming and clinic. First off, how was the appointment? Like I said, the appointment was just a pro fee, just a cleaning. We do these a lot in the beginning in our D3 year because all of our patients essentially need perio. They all need cleanings. We like to keep them updated every 6 months. So essentially the first thing that we're doing with all of our patients is getting them in the chair, introducing ourselves, and cleaning their teeth. And that sort of unlocks or opens up the other procedures that they will need down the road that we will get to do. This patient was great. They were super nice, and they were also very healthy. So I was able to get in and do the job quite well pretty quickly because, once again, not a whole lot of plaque or calculus buildup, and that makes my job as the dentist or the practitioner easy. Really, at this point, it's just continuing to learn how the clinic functions. There's so many things that we need to know, so many areas of the clinic that we're learning, both physically and then also like organizationally and software wise. There's just so many things that we're learning, and all of it's kind of been piling up. But the further we get into it, the more comfortable I've felt, which has been great. Just so you are aware, because I couldn't obviously film the appointment, the way that a Profi appointment works is we start with a start check, and that happens with every single patient. That's essentially a form that we put into the software where we go through a questionnaire with the patient to make sure that nothing major has changed in mostly their medical history since the last time they've been in. Importantly, we will take their blood pressure. We do that with every single patient to make sure that they are treatable based on their blood pressure reading. And then we'll also look at their medications and make sure that everything is good there. Then with the Profi appointment, we go through probing, plaque, and bleeding. So probing is checking the probing depths, essentially measurements of the gums. Plaque is a buildup of plaque. We use a disclosing tablet to see what is on the teeth, which essentially gives us an idea about the patient's oral hygiene leading up to the appointment. And then bleeding is also how much the gums bleed when we do that probing. All those things are charted. They're all added into the patient's profile on the software. And then after that, we get into the cleaning. With most patients, we're going to go in with an ultrasonic and actually clean their teeth that way because they tend to have, especially at the school, they tend to have bigger buildups of calculus and things. So we'll do a gross debridement with an ultrasonic and get the majority of it removed. After that, we'll go in with hand instruments and get everything else that we need to do, like in a fine manner with hand instruments. Today, since the patient was very clean and was taking care of themselves, I actually just did hand scaling. So just used the hand instruments, went in and got the job done that way. After the actual cleaning, we do polishing of the teeth and then floss, and then we do oral hygiene instruction, which is essentially just telling the patient to continue brushing, to floss, all those things that we need to do. This appointment today, the patient wants whitening trays, so I took impressions on the patient, and that was a relatively easy process. I needed a bigger tray, a slightly larger tray, but other than that, just taking alginate impressions over and over again in the clinic, I've started to get better at them. Just with time, I'm starting to see what I need to see, like which patients need a certain size tray and just how to load the tray and how to actually get it in there and get a good impression. I seem to be getting good alginates every single time now, which is really good. And then I quickly poured up the impressions, which you saw a little bit of. That process is kind of hectic because you have to get those impressions poured up within 30 minutes of making them, and that has to do with the material itself. Alginate can actually distort quite a bit in that time after the impression is taken. So you want to get in there and pour up those casts, make those things so that there's no distortion. And then just everything else that goes into the clinic. There's the sterilization where we keep everything, the dispensaries and what is all in there. There's the cubicle setup and tear down. There's the note that we do at the end. There's just a ton of stuff. And part of my biggest concern was just how am I going to film all of this process? So what are my thoughts on this video? Well, I think that I did a decent job filming things. It is really, really weird for me to film in the clinic because it's not something that's probably ever been done by a student at my school. People just don't really film themselves with a big camera like I have here in the clinic. So it was definitely strange. And the other thing is that we can't include any patients in the videos, at least to my knowledge. So it's very important that I keep any possibility of patients out of these videos, and that I intend to do. But there's so many steps to the clinic, there's so much to learn and do, it makes filming these videos kind of tough. I'm really just trying to continue to update you on the dental school process. I remember being a pre-dental student and having no idea what it was like to be in a dental clinic and to actually do work on a patient. And like I said, it's gonna be difficult for me to show that because I can't really do patient interaction while I'm in school, but I'm gonna try my best to kind of give you an idea what the appointments are like and show you what dental school is like moving into the 3rd and 4th years. This was really fun though, as always. I wish I could have gotten more of my friends in it. It was crazy this afternoon, everybody on a Friday afternoon trying to squeeze in that last appointment, but I got some footage and I think this will be a good baseline for my vlogs in the clinic moving forward. I now have done it. I now know what the experience is like, so moving forward, I can pick days when filming will be good and give you guys more vlogs. If you're new to the channel, make sure that you subscribe right now. That way you won't miss any of those vlogs or any of the other videos that I put out. And also, if you're still with me, that means you're somebody who's loyal and you enjoy the videos. First off, thank you. But second off, please check out the video that I just released and created on the channel. And that video is simply titled Why Dental School. It is, in my opinion, the best video I've ever made. It's my favorite video. It is a video that literally, when I was editing it, I got chills making it because it meant so much to me. It is sort of the culmination of years of hard work put into video form. And I would absolutely love if each and every one of you go and check that out. So I'll leave the link right here for that. But for the rest of you, thank you for watching. I appreciate it. Thank you for your continued support. We're shooting for 10K at this point. We'll be at 10K subscribers soon, and I'm really just thankful for that. The vlogs have come a long way. The channel has come a long way. Super excited about the future. So if you don't want to miss any of that, make sure you subscribe, like this video if you enjoyed it, and let me know what you think about the entire process of me being in the clinic down in the comments. Thank you guys as always for watching, and I will see you in the next one.